Hello everyone, Chris here. Hope everyone's doing well. Today we're going to take a look at the most basic type of continuous medication aerosol system. Something you might utilize in the emergency room, something that is simple, quick, and easy to set up to deliver a continuous bronchodilator therapy. As you know, there's many other ways to apply continuous medication. We can use an aerogen, depending on if the patient's on CPAP, etc., on a ventilator. There are other ways to provide that, but what I'm going to show you today is a very simple setup utilizing the Hope nebulizer. And again, follow all processes or procedures in your hospital. The Hope nebulizer comes with a package insert that allows a therapist to calculate the dosing by adding saline and how much a bronchodilator to the nebulizer to have an output of how many hours. Now that is very important that you follow those directions completely and precisely, but some hospitals these days are requiring pharmacy to be involved in the mixture of medications in that way. So make sure that you follow your hospital's policies and procedures. But today we're just going to look at a very simple system, a continuous aerosolization of medications with the Hope nebulizer. All right, everyone, here is the Hope nebulizer. It's somewhat of a large volume nebulizer, kind of a specific use designed to deliver continuous medication. As you can see, it can be connected to a flow meter on a blender, so that's recommended. This doesn't have air entrainment ports. There's no FiO2 adjustments like we saw on our bland aerosol nebulizer that has the dial and the venturi. This one is a sealed system. You can connect up the flow meter here, and you would use a blender to set your FiO2 on whatever that physician orders there. Now, again, the Hope nebulizer unscrews this way. The medication can be inserted in the container. The physician would order how much bronchodilator in milligrams per hour, or a total dose that the doctor may want administered. And again, once you have that order, you can use the Hope package insert to help mix saline with, in this case, let's say example of albuterol, to get the concentration that the physician has ordered. There's an additional port here if, let's say that pharmacy could mix a bag of medication that we can dispense over a period of time. You can do that with a bag hanging and the IV tubing inserted into this port here and drip the medication, keeping the the container full of medication. That can be on just a TKO where you adjust the hand port on the IV to infuse, or even an IV pump can be utilized if that's required. So again, here's the Hope nebulizer. So next we're going to go ahead and connect this up to the flow meter and just demonstrate on a pullback shot what this system would look like. All right, everybody, there's the Hope nebulizer. In this example, we've just connected it to a simple flow meter. But again, there is no FiO2 adjustment on the Hope nebulizer. So you really would only be getting 100% source gas, and that would most likely not be appropriate. So you're going to want to utilize your blender, that you can connect this to the blender and dial in the FiO2 that the physician has ordered. Now, very much like our bland aerosol setup, we're going to set the flow. We're going to get the flow into the tubing. We're going to have a drain bag and route that all the way over to the patient. Now, in the case of a continuous aerosol of medication, the drain bag is less important because, again, the medication is usually going to be delivered just over an hour or so. Most likely not enough time to have a lot of rain out being generated like you would with a bland aerosol nebulizer, which has a lot of aerosol output. The other things you want to do, if you are going to mix this medication at the bedside and utilize the Hope nebulizer's package insert, which includes dosing, again, I would recommend highly that you have another RT or an RN work together with you to ensure that you're providing the right concentration, whatever the physician has ordered. Nursing oftentimes does a 2-system check where two nurses are looking at the system to make sure that the concentration that you've mixed is appropriate. Now, more and more, the pharmacy is mixing these kinds of medications, so you're going to want to follow your hospital's policies and procedures. And remember, it's always appropriate, if there's a question, to reach out to your pharmacist to ask how this might be mixed and get assistance. They are the experts in mixing medications, and they do not mind the questions to ensure that we're giving the right concentrations to our patients. Giving continuous bronchodilators is serious business, and you want to make sure that you're providing the right concentration for your patients. So I hope that's been helpful, everyone, and until next time, be well.